Hello, podcast listeners. You are now listening to the Coffee, Health, and Science podcast. I'm your host, Jordan River, and I want to thank you for tuning in today. Dr. Stephen Helschein, AKA Dr. Coffee, is back on the line. How you doing, Dr. Coffee?
Another day above ground, living the dream, my friend. How are you?
I'm doing excellent. Excellent. Love doing this podcast. Love spreading the information. Just such good stuff. And today's episode is going to be really great because we're diving into the relationship between coffee and a specific organ. That's what I'm looking forward to, Dr. Steve, is diving into these specifics. Coffee in the brain, coffee in the liver, these, specific relationships. So today, we are going to be discussing coffee and the heart. You ready to get started, Dr. Steve?
Oh, I'm excited because, our whole program, my whole focus is cardiovascular disease. So
that's right.
Level 1 diagnostics is a early detection program done out of primary care offices for heart health. And I've written extensively on the heart. And so when we marry my favorite thing in life, coffee, and my favorite organ in life, the heart, I'm the happy camper.
That's
so
a
let's
beautiful,
dive into it.
Yeah, totally. And just really quick before we get started on coffee, that detection system that you have there's not anything else out there like that, is there? You're really breaking some ground there.
We are doing incredible things. It's the only early warning detection system that non-invasively doesn't even prick your finger and can give you 80% of the information of that of an angiogram from the neck down.
Jeez.
So I haven't figured out how to look at cerebral aneurysms yet, but we're getting close to it with ultrasound.
Wow.
But everything else in a 40-minute period of time that insurance companies love to pay for, we can detect early warning indications. And because we've been doing this for 14 years now, we can look at whether or not there are treatments available. And of course, we know the number one treatment is what?
Coffee.
Hey, there you go.
Love it. I got my cup right here, man. So let me take a swig and then we'll jump right in. So here's what I'm thinking, Dr. Steve. First, I want to kind of impart on the listeners how important and impactful cardiovascular disease is as a subject in the United States. Can you go over some of the statistics from United States heart disease?
So in this country, there are 1 million people that die per year of heart disease.
Wow.
Some people think it's a man's disease. It's not. 500,000 women die per year from heart disease. If you look at the 1 million people, 10% of them, or 100,000 people per year, die from a condition called sudden cardiac death. And Jordan, I know this isn't your bailiwick, that you're really the podcast and the video guy, and
right.
But I know you've learned some things. So what's the number one symptom of sudden cardiac death?
Is it the stopping of the heart and death?
It's death, and that's one hell of a wake-up call for your patients.
Right.
So 100,000 people, the first sign that they have a problem is they die.
Jeez.
And that's people like, the newscaster Tim Russert, who did Meet the Press, and he went into his hospital in D.C. and had a full workup, and they put him on a statin, and they put him on aspirin, and they told him to lose some weight, and he dropped dead from sudden cardiac death. And the problem is that they're not looking at a marker called heart rate variability. They're looking at the EKG, but it takes longer to do an EKG, to put the strips on a person for the EKG than it does to run the 30-second rhythm strip. So you can have an EKG and then walk out and drop dead in the parking lot.
No, that's really interesting. I listened to a couple different podcasts, and there was a nutritionist on who was a trainer for a world champion MMA fighter. He's like the nutritionist for this guy, and he went into this whole speech on variable heart rate and how he tracks the athlete when he sleeps, and he measures his variable heart rate, and the next day he'll either say, no, it was too wide range, you need to take today off and rest, or he'll say, okay, you had some good measures last night, so we're going to hit the gym hard. Is that kind of what you're talking about?
That is. So, I have a monograph I wrote on heart rate variability and pulse wave velocity that I would be glad to send any of your readers. And
Definitely.
in it, we talk about how to train an athlete with heart rate variability so that you're not overtraining. And we can use that as a measure. But even deeper than that, if you take a patient that walks into the office and you run them on heart rate variability and you tease them so that you do resting, deep breathing, bearing down, which they call Valsalva, and tilt. If they're going to have a bunch of blips, it's going to show up in those transitions.
All right.
And we're going to be able to pick out an arrhythmia that everybody else has missed with their simple 30-second heart rhythm strip.
Fascinating stuff, man. That's really, really interesting. I'm so glad that you're so well-versed on the heart specifically because, I think a lot of people have heard of the brain health, benefits from coffee, the reduction in Parkinson's and dementia. I think a lot of people know about liver disease, but not a lot of people know about coffee in the heart. Is that what you found as well?
Sure, that's what I found as well, and I don't think people understand the importance.
Exactly.
If we take the next 7 reasons that people die, which includes all cancers, it includes dementia and Parkinson's and Alzheimer's, it includes pulmonary disease, kidney disease. If we add them up, they don't equal the 1 million people per year.
Whoa.
And let me tell you one other thing. Women, 500,000 women die from heart disease per year in this country. Out of that 500,000, again, 50,000 of them sudden cardiac death. Now, everybody walks around wearing these red ribbons. What's the red ribbon for?
Yeah, it's for the heart awareness, right?
And what's the pink ribbon that the women wear for?
Now, that's the breast cancer one.
And they've done a phenomenal job, the Susan Komen Foundation, of raising money and awareness for breast cancer. And so I'm not belittling breast cancer at all, terrible disease. But 36,000 women last year died from breast cancer. 500,000 women died from heart disease.
Wow. So over 10 times, almost 20 times as much. Well,
Exactly.
Geez, that is fascinating stuff. As the lay person, you don't see the numbers. And also when you deal with numbers this big, they all kind of blend together. As a doctor, I'm sure you have a lot of references. You've seen epidemics and you've seen things that weren't epidemics. But as a lay person, it's like big numbers are big numbers. But what you're saying is heart disease is the number one enemy, it seems like.
How long have we been talking so far, Jordan? You have all those controls on your podcast dial.
10 minutes or so.
10 minutes. So that means 20 people right now have died since we started talking from a heart attack.
Jeez, that is wild.
So every 38 seconds, somebody dies from a heart attack.
And this is all related to heart health. And what I want to know from you is, okay, so we know coffee is good for the heart. What is it doing in the heart?
Right. So there are 2 parts to, and it's not just the heart. So the cardiovascular system, which is the system of the heart, which is the electrical mechanical pump that pumps the blood out. And if you think about it, if I would tell you right now to grab a tennis ball and to start squeezing and relaxing, after about 3 or 4 minutes, you tell me, hey, my hand's really getting tired.
Right.
My hand's starting to hurt. Your heart beats 100,000 times without ever taking a break.
Whoa.
The heart never rests.
That's
It may
crazy.
slow down at night when you're sleeping unless you have sleep apnea, at which case you keep going into fits and starts with your heart.
Right.
But it never takes a rest. It will beat your whole entire life until it doesn't, and then you're dead.
That's freaky, man. You're
And
freaking me out, Steve. No, I'm just kidding.
and not only does the electrical mechanical pump have to work, but it has to have valves, these doors that open and close properly to let the blood out and to not let the backlog in. And then it has to have a clean highway system away from the heart with the oxygenated blood, which is your arteries, capillaries, and then
the
back
pipes,
to the
pipe's got to be clean.
Yeah, the pipe's got to be clean, and then back to the heart with the veins, which they're going to go to the lungs and re-oxygenate the blood, and then back to the heart for pumping. So it's a vicious cycle, and it's got to be working as efficiently as possible. And once you start building up plaque formation in the artery, we're going to go into the answer to your question. I didn't forget it, which is, what causes the problem. But I wanted everybody to make sure they understood. We're not talking about the heart. We're talking about the cardiovascular system, which is a oxygen delivery system.
Right.
And let me leave you with one more point, Jordan. We can live a month without food. We can live a week without water. We can live maybe 5 minutes without coffee, of course. But we can only live 3 minutes without oxygen.
Right.
Oxygen is our most important macronutrient. And the whole purpose of the cardiovascular system is to bring oxygen from the tip of your nose to the bottom of your toes.
Wow.
And it can't do that if there's plaque or inflammation present.
Right. So, and that's the enemy is clogging up that system, blocking up that highway.
Right. But it's twofold. It's plaque and inflammation. And people don't understand inflammation as the major cause of all degenerative diseases in the body.
Okay, so what are we doing to put all this calcium and plaque in our blood vessels? In our arteries.
Right. So first of all, we've got lifestyle, things that we're doing to create plaque, and then we have lifestyle things we're doing not to prevent plaque.
Okay, yeah.
Two edges of a sword. So if the blood is the oxygen delivery system and we're smoking, then we're ruining our ability to carry oxygen. If the blood is the oxygen delivery system and we're not exercising in a sense of high intensity interval training where we're not increasing our blood flow as much as we can into the very small areas of our body, breaking down the resistance into the tips of our toes and the little vascular beds in behind your eyeball. If you're not pushing blood to it, if you're sitting all day at a desk and you're not doing anything to push the blood, then you're not getting oxygen to those areas.
Jeez, that's fascinating. I never thought about it like that.
So if our blood pressure is high and we're not doing things to reduce blood pressure, like a DASH diet where we're restricting sodium, or we're not doing grip strength exercise to increase nitric oxide formation, or we're not increasing good quality coffee to increase nitric oxide formation, then our blood pressure is going to stay high. And that's going to beat the hell out of the walls of the artery, almost like power washing the side of your house with full pressure power wash and tearing the paint off.
Whoa. Wow, that's wild.
Am I making these visuals good for you?
You're nailing it, man. And that's another reason why, coffee is such an easy move, right? You don't have to get off your butt. And that's probably why doctors like it, is that people will actually do it. And doctors hate when I ask this question, Dr. Steve, but in your experience, what do you think the highest leverage move is, or the highest lack thereof? Is lack of exercise what's doing, if you had to pick one, What is the highest leverage problem?
Yeah, the problem with exercise is I always spill my cup of coffee while I'm running. Look, if we look at risk factors like cigarette smoking, high blood pressure, LDL cholesterol, hyperglycemia or high blood sugar, obesity or insulin resistance, all those things can be helped by exercise.
Mm-hmm.
But all those things also can be helped with coffee drinking and water intake.
Mm-hmm.
And since you can easily make a commitment to making 4 clean cups of coffee using high quality coffee like Purity and high quality water, maybe even using like a Vitev filter system
Mm-hmm.
to increase the quality of the water, then all you really have to also worry about is when you're going to get out to jog, because now you got the good caffeine in your system and the good antioxidants. You're going to feel good about going out for a run or
Right.
doing your yoga asanas. We have in our book, Your Finest Hour, we talk about in the morning doing your yoga asanas, and we outline which ones should be done
Oh, that's great.
as part of the program. But exercise and how you eat and the air you breathe, all of those are fine. I sit here, I've got this air purifier next to my desk because we can live a month without food, a week without water, 5 minutes without coffee, 3 minutes without good quality oxygen. So
Mm-hmm.
you got to maximize all of those things.
So is it just the anti-inflammatory properties that are so effective in the cardiovascular system from coffee? Is that what's preventing the calcium buildup?
That is probably the biggest thing that we control, but it really is a topic of ongoing research.
Interesting.
We really don't understand exactly how inflammation plays a role in heart attack and stroke, but we do know that if we do blood work on patients and we find inflammatory markers that are high, that there's a significant risk for heart attack and stroke.
Okay.
We haven't really pieced together how it is, but I can tell you what I think and what the VA Boston healthcare study and
Sure.
the Women's Hospital study showed. What it shows is that inflammation causes the lining of the artery to change so that it's not able to secrete nitric oxide properly. And it all starts in the wall of the artery. In 1998, 3 Americans discovered that the lining of the artery, what's called the endothelial lining, secretes nitric oxide as a gas. And they got the Nobel Prize for Medicine and Physiology for this discovery. Because up till that point, we thought the lining of the artery was just like the lining of a suit. It looked good, but it had no real function.
Keep it in there.
Yeah, that's right. What they discovered is that nitric oxide is created. It causes the dilation of the artery, and it went on to the discovery of Viagra.
Oh, wow. Interesting. The nitric oxide, is that okay?
So what happens is that the line in the artery can't secrete nitric oxide gas. It doesn't dilate properly. It becomes stiffer. Then the blood pressure pushes the blood into the artery. It hits the wall. The wall is not responsive to being elastic. It becomes stiffer. It then creates a disruption. So it's almost like Velcro on the side of the artery, on the inside of the artery. The Velcro then picks up the plaque or the calcium or the dead blood cells as they float by in the blood, and it starts to build up plaque. So we know that that is one of the reasons
Wow.
for why this happens. Then the second reason is that the inflammation in the body that inflammation causes, just like when you get an inflammation anywhere, it causes a thickening. And that thickening is almost, when you drive, you know how you drive over a speed bump
Mm-hmm.
and there's consequences if you don't slow down?
Right.
So the same thing occurs. There's consequences when the blood
Blood vessels.
supply is being
Wow.
pushed through the artery, and it hits these speed bumps. And the speed bumps are already like Velcro; they just pick up more and more plaque.
Jeez, that's wild, man. This is the exact kind of information that I'm looking for. It's really quite enlightening. Talk to me about stroke, though. I know that there's a huge effect of coffee in stroke risk.
When it comes to stroke, there are a number of studies done at Johns Hopkins University in the School of Public Health,
Mm-hmm.
where they studied 25,000 men and women from South Korea. The average age was 41. None had any evidence of cardiovascular disease. They had a yearly health exam when they were asked if they drank coffee.
Mm-hmm.
They were also asked what kind of foods they ate, and then they did a coronary calcium score. So what a coronary calcium score is, it's a CT, it's a high level CT scan in which they use a low amount of radiation. They go across the coronary arteries and they measure the amount of calcium buildup in the arteries.
Mm-hmm.
They compared the participants to how much coffee they drank, and there was a direct correlation between coffee and calcium score. As coffee consumption rose, the amount of calcium buildup declined.
Mm.
Those who drank 3 to 5 cups a day had the least amount of calcium buildup, and the association between higher coffee consumption and lower calcium buildup stayed the same when they looked at age, sex, smoking, alcohol,
Jeez.
diabetes, obesity, hypertension, and high cholesterol. So they looked at all the other risk factors, and coffee consumption was an independent factor
Right.
in reducing the risk factors across the board
It's
of calcium buildup.
It's and this is all contributing to the reduction in stroke. I assume is where you're going with this. It's just so crazy the effectiveness and the lack of information out there, the lack of knowledge. It's really
Right.
really
So
stunning.
it really is stunning. And I know you like numbers, so we looked at the Nurses' Health Study. That was the one done, I believe, at the VA. There were 80,000 women.
Mm-hmm.
They found that those who drank 2 to 3 cups of coffee a week
Oh wow!
had a week had a 19% reduction.
Jeez.
And those who drank 4 or more cups per week had a 20% reduction.
Wow. That's wild. Again, this is when you're looking for any truth in medicine, there are certain boxes you're looking to tick. One, like you said, is the is moving the variable, right? So you test it among all these different people, so you know coffee is the one variable. Another one that we mentioned before on the show is dose dependency. The more they drink, the more of an effect that it has. That's a pretty big red flag, or let's say green flag for go to the coffee. Why is there still resistance to this, Dr. Coffee, in the medical world? I mean, among professionals.
Yes. So the amount of time that it takes for education of an item to get into the general medical community is approximately 7 years.
Oh, wow.
So if we really do our research and look at the feelings of coffee 7 years ago or 10 years ago, then we know that most people at that time had their doubts that coffee was healthy. If we look at 15 years ago, we're really looking at people who thought coffee drinking is unhealthy.
Yep.
And I mean, I understand it. My mom, may she rest in peace, would take her aluminum percolator and
wow.
pour in her, I'm not going to disparage, but one of the off-the-shelf grocery store brands.
Right.
And pour it in and take her tap water from, the faucet and pour it in. And she'd cook it up in the morning and the percolator would boil it, overheat it, and then it would sit there all day and she'd sit there and pour her cups all day long. I mean, of course, it didn't show any bang for the buck as far as health goes.
Right.
I mean, that's at the same time they were sitting and trying to make the case that everybody should eat sugar and not eat fat.
Yeah, that's exactly right. Yeah.
And you can see where that led. That led to this obesity and diabetes epidemic.
That's exactly right. I mean, I'm deeply involved in that subject, and you're absolutely right. We should do a whole episode down the road on false coffee studies, old coffee studies, because a lot of these studies were done in the 50s. When there were so many other risk factors, rampant smoking and alcohol use and inactivity that nobody really seemed to notice or care about, right?
That's correct. I mean, big problems with the early studies because you weren't able, people were smoking a lot more, and it was, we've now at least limited where people can smoke, and we have a lot of education to convince people not to smoke. But when your breakfast is 3 cigarettes and a cup of aluminum percolated bad water off the shelf coffee, you're not doing yourself any good. So,
wow. It's some fascinating stuff, Dr. Coffee. As always, very enlightening. How about a recap for the audience?
I'll be glad to. So, our cardiovascular system is our oxygen delivery system. We can only live for 3 minutes without oxygen, and we need good circulation. And when it starts to fall apart, it becomes exponential in that it falls apart more rapidly. As we start to build up plaque, we build up more and more plaque. The biggest change you can make to affect this is to make a good quality, like purity coffee, and drink 4 cups a day, and use good quality water like a Vitev water purification system. There's lots out there. I happen to like a couple of them. Vitev is one, but you want to use good quality water in your coffee, and you don't want to use a lot of refined sugar in it. You want to keep it black is the best for medicinal value. And you want to drink your 4 cups of coffee a day because statistically that shows at least a 25 to 30% reduction in cardiovascular risk factors. And all the risk factors that we're talking about, from diabetes, which is sugar handling, to obesity, to plaque formation, all of those risk factors are helped by drinking coffee.
Incredible. And a 19 or 20% reduction in stroke. Amazing stuff, Dr. Coffee. Thank you so much for taking the time to do this, as usual.
Well, I'm going to go make a new fresh pot of coffee, so I will talk to you later. Thanks very much for your time today.
Of course. Everybody out there, thank you for listening. I'll see you next time on the Coffee, Health, and Science Podcast.